Do people experiencing homelessness have equitable access to primary care?
Well, the short answer is no. um, and I mean, for sure, people have primary care. Some people have primary care physicians. They have primary care nurse practitioners. People can access services from primary care clinics and walk-in clinics, but sometimes these are not spaces that are necessarily always safe for people. Like, and I'm not talking about physically safe, I'm talking about the environment isn't an environment in which, people who experience homelessness, who often also have experienced lots of trauma, may have experienced violence, may have substance use issues, um, where they've experienced discrimination and stigmatization because of these things. So sometimes they have good primary care, but equitable access, I would say no. And in fact, in a lot of the work that we do, we know that many people don't have primary care practitioners at all. And so, the result of that, or our services, our primary care services not being set up in ways that are accessible for folks. We see a lot of people arriving in hospital emergency departments. And hospital emergency departments are not known to be the safest place for folks that experience homelessness, or for anybody that experiences any kind of structural vulnerability. Mm-hmm. So, I think we have people that have access, and sometimes it's fine, but we have a lot of people who don't have access. Absolutely.
Yeah, absolutely. Absolutely. We have a system in Ontario where we roster patients to family physicians. And I work in rural homelessness is what I look at. So they say that a person has a primary physician, but the primary physician lives 30 clicks away, and that's the one they've been assigned to.
Yeah, and they have no
and no transportation.
They have
no
no
way to get over there.
And I think the thing is that like you have a question here about specialized primary care, and one of the things I think is I'm not a big proponent of specialized services, only because people who are homeless and or face other kinds of inequities are cared for everywhere in our healthcare system, and there's core things that all healthcare providers should know. Something about harm reduction, something about trauma and violence informed care, something about the social determinants of health, and how things like housing and transportation and food security and all those things actually come into play when we're caring for people who experience homelessness. We all need to understand cultural humility and cultural safety, and all these things are absolutely key to good primary care. And to any care in the healthcare system, whether you're homeless or not, experience homelessness or not. But there definitely are models across Canada. Like a lot of my work is in palliative care. Mm-hmm. And I work really closely we have mobile palliative care teams across Canada that are very low barrier and basically go to where people are at. And so there's a Peach team in Toronto that you might be familiar with. There's a Camp team in Calgary, and the Port team in Victoria, and Peacoat in Edmonton, focused on Indigenous populations. And the model, I would say, so many of the people that we see in those services are not people that we would say, they're going to die in the next few weeks, although sometimes that's the case. But we really attempt to see people upstream, and we go to where people are. Mm-hmm. And that's primary palliative care, but oftentimes our primary palliative care are a lot of the same issues that people that work in physicians or nurses that work in primary care would need to be dealing with. So I like the model of going to where people are, as opposed to the model of us expecting folks who often lead, really challenging lives to actually have to come to our doors. And so I like this idea of outreach. And I've always been a big proponent, say, of street nursing services, because street nurses are often a really good gateway for people who experience structural vulnerabilities to get into services that they need.